For the next presentation, our presenters are going to be joining virtually. This is the project that is near and dear to my heart. This is the ISODP Journal Watch that Sunny and I have been providing the the physician support for, but a lot of the heavy lifting has been done by Sylvia and Amina, who are going to be presenting. Sylvia is the president of the University of Regina's Stem Cell Club, recently graduated with a degree in biochem, and with the hopes of becoming a physician in the near future. She is also the lead on the Black Donors Save Lives national campaign. Amina Silva is a registered nurse and the last year of a PhD at Queen's. Clinical background focused on end-of-life care, kidney transplantation, and eye donation processes. Research program is focused on organ donation processes, end-of-life, and survivorship. She is also the research coordinator for the BRIC program, which I think most of us heard about, studying burnout and compassion fatigue in coordinators, and is a research assistant at Queen's and a simulation facilitator at the University of Ottawa. So with that introduction done, I'll turn it over to you for the presentation.
Thank you very much. Can you guys hear me? I will understand the silence as a yes. Okay, guys. So thank you very much for that kindly introduction, Matthew. So in the last couple of months, you and I have been having the pleasure of helping with the Journal Watch editions for this year. And today we'd like to share a little bit with you guys on the background and the process that we followed throughout the development of each of those editions. So just to start, why exactly is the Journal Watch needed? So as many of you may be aware, there is a lack of journals that are specific for the disease organ donation process, as most of the journal focus on the transplantation side. And because of that, usually donation and transplantation, they are very discussed interchangeably, but as you guys know, they are very distinct process. And so to help fill in this gap, the Journal Watch was created by the International Society for Organ Donation and Procurement, and they created this initiative last year in 2021, and the first editions were led by researchers in UK. And so the main goal of that society is to enhance resources to improve donation practices and to establish an integrated network of donation professionals. And so the Journal Watch was created as an educational resource to benefit the members of that society. And even though the editions of the last year were led by a team of researchers from UK, the editions from this year were led by researchers in Canada, by being more specifically, Dr. Matthew Wales and Dr. Sonny Danani. And just kind of to exemplify a little bit what I just told you guys. So as you can see, after a very quick searching process, we could locate over 40 journals worldwide related to transplantation, but we could not locate none of them that were specific for the disease organ donation process. So that really kind of shows the importance of having more strategies that are specific for disease organ donation. And so we brought here a couple of the benefits from the Journal Watch. So in the Journal Watch, we identify the most relevant publications and we provide summaries from those articles. So that really makes the available comprehensive literature that's easy for the readers to just access. And they know those are reliable resources because we assess the quality of every and each article before including them in the next issues. And also just to highlight, so the ultimate goal of the Journal Watch is to lead to the creation of a journal that's entirely dedicated for organ donation. And of course, there are more people involved in the Journal Watch, but that's kind of what we call the core team working in the editions of this year. So we have Matthew Wise and Sonny Danani, who are the leaders for this year. CDTRP trainees, we have myself, Amina, and Sylvia. And we also have from CDTRP, Stephanie Lariviere, supporting all the design process of each of the editions we are creating. So now just very quickly, how exactly this creation process of each edition happens. So the first thing we do, so the core team I just mentioned for you guys, we are responsible to conducting searches in different databases to try to select the most relevant articles for disease organ donation published in the last 6 months. And we also set up a lot of publication alerts in different databases. So every time a potentially relevant article is published, we receive an email with an alert so we can check and see whether or not we should consider this article for the next issues of the Journal Watch. So usually when we do this database searching process, we come up with about 20 to 30 articles, and then we had a meeting with everyone together to discuss those articles. So when we look for the different articles we find, we are looking for specific things. So the first thing we're looking is geographic locations, because we don't want it to be selecting papers that are all published in the same place. So for example, only North America. We really wanted to have this representability across different areas. Another aspect we are always looking for is also diversity of the topics. As you guys know, the disease organ donation is a multiphased process. So we try to not get multiple articles in the same phase of the process. So just as an example, if we get one article that's very specific for conversations with family members for organ donation, we are going to try to get the next one related to management of the donors. So we kind of can cover all the different aspects for disease organ donation. And the last thing we do, it is to access the quality of those papers. So really, we are looking where those papers are published, who published, and for the methods to make sure those papers are actually of quality to be included in the next issues. And once we follow all this process, we usually end with about 5 to 7 papers. Usually it is 7 papers, but for example, the last edition is going to be 5. So it's kind of this range that we work with. And now we have a couple of details more specific for the writing process, and Steve is going to speak on those for us.
Thank you so much, Amina. So after the creation process, which as Amina mentioned entails the gathering of recent and applicable papers, we move on to, in my opinion, one of the most exciting parts, which is the actual writing. So first of all, we disseminate between 2 to 3 papers on average per reviewer. The reviewer is tasked with carefully reading each of the assigned papers, then writing a detailed summary of the research objective, methodology, as well as some key findings. Next, the reviewers send these summaries off to the leaders, so Sonny and Matt. And what they do, they just check for verbiage usage and ensuring that each reviewer has effectively captured the essence of each of those assigned papers. And once that's all done and the summaries are approved, we move on to the part that I know less about, thanks to the wonderful help of Stephanie, which is design creation. So she pretty much just makes sure that the summaries look pretty in the Journal Watch. And lastly, we connect with corresponding authors, informing them about the involvement of their work in the Journal Watch. Next slide. Here's a sample of the September 2022 Journal Watch edition with 2 summaries on the left, and you can see the wonderful design creation by Stephanie. And on the right, we can see an introductory page that touches on the broad range of summaries that the audience will be exposed to. Next slide. You might be wondering, how is this all disseminated? So the Journal Watch is distributed by the Transplantation Society. So they send out a newsletter to all ISODP members, and they put the content on their website as well. For the on the CDTRP side of things, we publish the Journal Watch latest edition on the website, and we also share it on all the social media platforms, so Facebook, Twitter, as well as on the newsletter. Next slide. Next, I'd like to show you some metrics where we kind of analyze the reach of the monthly Journal Watch editions. If I could draw your attention to the bar graph on the left, it highlights the top 5 countries that are accessing the ISODP Journal Watch, with the United Arab Emirates accounting for close to 50% of the readers, and the United States accounting for roughly 21%. And on the right, we have recipient analytics showing the percentage of ISODP members that actually receive the emails containing the Journal Watch, opened the emails, or didn't open it at all. And what we kind of found out here was most of the members are actually using some sort of Apple device, like an iPhone, an iPad, or whatever that might be. They actually have an Apple Mail privacy protection feature. And we assume that's would potentially explain the high rate of people who didn't open the email just because of that privacy protection feature on their device. Next slide. And here is a representation of the origin of the articles that we've selected for past editions of the Journal Watch. We pride ourselves in the diversity of our paper selection. And as you can see, we have a mix of papers coming from North America, South America, Australia, Europe, the Middle East, East Asia, and so much more. And we hope to continue reflecting this diversity in our subsequent Journal Watch editions. Next slide. So as I come to a close here, the next steps for this initiative is, for one, to keep the ISODP Journal Watch going. And as Amina touched on earlier on, there is a need for a journal specific to organ donation. So that's something we definitely need to work more towards. And to improve dissemination strategies. So figure out why most of the emails are bouncing back. Do we have just wrong emails? Are those emails outdated? Do we need to get more? And the Apple privacy protection feature is something we need to discuss with the ISODP members if it's something they can toggle on their settings to turn that off. Next slide, please. Finally, we would like to hear from you and the work you're doing, and please contact Matthew or Sunny, and we would like to involve your work in part of our journal. And on behalf of the ISODP team, we'd like to say thank you for the opportunity to present today, and I really do look forward to questions. Thank you.
Thank you very much, Sylvia and Amina. Are there any questions? Okay, great. So there are no questions online. And I've been reminded that we need to make sure people identify themselves when you come up to ask your questions.
Yeah, hi, I'm Rink DeVries, heart transplant recipients. I have a question. I haven't read Journal Watch. Is that written mainly for researchers, for clinicians, or is it also for patients?
It's a great question. I think it's mostly written for professional stakeholders, either administrators or researchers in the field. I think that I think it would be accessible for PFDs that were interested in the research side of things and seeing where things were going. We try to keep the summary language written at a relatively accessible level. Oh, sorry, I jumped in to answer the question, guys. Sorry. Any other? Oh, great. Trisha's coming.
Hi, Patricia Gongo here. I was wondering about that last next step, improving dissemination strategies. What ideas do you have for that? What kind of strategies were you thinking about?
Amina,
I can, top of my head, that would be that Apple protection feature, because speaking with one of the teams over the TTS, that's an issue where most of the emails, it just doesn't get to the recipient. So I think that would be something we could bring up with the members of ISODP, figuring out a way to, I guess, disengage that feature to allow them get most of that email. And although bounced emails, I believe were around 4%, not a whole lot, but I mean, if we could get those 4% into a category of people who actually open the email, that would be, in my opinion, great. So those are the two strategies we're considering as of right now.
Yeah, and just to add on what Sylvia said, it's not only to improve dissemination strategy related to the Journal Watch, but also for the publications in disease organ donation. Since those publications, they are being published across different journals with different specialties, we need to make sure we are using consistent methods to share those papers and to even index those papers so people can actually be assessing those papers. Because sometimes you have a lot of publications, but if they are not in the correct place to be published, your target audience may not even get to read those. So therefore, even in that side, the Journal Watch can help as being a type of dissemination strategy for those journals, for those papers that are being published in transplantation journals.
And we have time for one last question, Murat.
Murat Slesser, donation physician from London. Thanks for that presentation. I was just searching Twitter and I couldn't find your Twitter handle. And I don't know about you, but my mailbox is a hot mess. So, I don't know if the emails are bouncing. There's 4 emails coming to a single, 4 email accounts linked to a single inbox that sometimes starts to fail. And so You know, I avoid it. Like it gives me anxiety to check my inbox. So if you can move to a more sort of, you know, a funner place where I'm checking my, you know, scores for games, that'll be great.
No, it's a great point. We have not been great about social media. I know that's not my forte. I don't know if you guys would like to establish this on Twitter or other social media platforms.
Note taken. We're going to try that next.
That would be great. Yeah, why not?
Well, definitely gonna hand that over to you guys to do, because I don't think Sunny is either. Very good at it. Steph, yes, Steph. Yeah, the social, yeah, there you go. All right. So I think Nick, you're gonna be moderating the next session. Okay, great. So thanks, guys. Very well done, and appreciate all your work all year long.